I'm Chris Roup. I'm the Executive Director with NAMI Fresno, the National Alliance on Mental Illness. And we are the largest grassroots organization providing mental health education, support, and advocacy efforts for people who are affected by mental health challenges. We've been doing this for a while. Our organization has existed for a little over 40 years. And we were created by a group of family members with loved ones living on this journey with mental health challenges. And they found a few things along the way. They realized that there are barriers to accessing the resources for care that they or their loved ones need. They also found that there are limited resources available for their loved ones who have mental health challenges and need additional support and care. But the bigger thing they ran into was stigma. They weren't really able to open up and share about these challenges, share about what may be going on with their loved one and the emotional impacts that had on them as family members. And they decided that they wanted to really make a difference, that there needed to be changes, and there also needed to be a safe place for families to open up and for their loved ones to be able to open up and share what their challenges may be and gain some peer support. And so that's how our alliance was created. We provide education, support, and advocacy for all people affected by mental health challenges. And I love how we deliver this to our community. We have two very unique ways of doing that. First, we deliver it all to our community at no cost. So there's never going to be a financial barrier to accessing our support groups or participating in attending one of our extensive education classes, or to have us come in and share and educate the community or your groups throughout the community. But the one that's more meaningful for me is lived experience that we provide in all of the work that we do. And what does that mean? Well, it means we are on this journey too. So we either live with a mental health diagnosis and we manage that in the best place of recovery that we can, demonstrating that that's possible and giving families and loved ones hope. Or we have a loved one on this journey somewhere on the spectrum of living with mental health challenges. And that's many different parts, but we bring those peer experiences into our work, reminding people that they're not alone, that we can lean on each other and share our wisdom and experiences and continue navigating the system and really doing a lot of work to reduce that stigma that still exists when someone's on this journey experiencing challenges and needing to either address them or reach out for help. Or even needing some support to gain awareness themselves that they may be experiencing challenges. And so I like to say NAMI has 3 buckets of work that we work in. We have programs for family members. So if you have a loved one, if you're a caregiver, if someone, a friend that you know is living with mental health challenges, we have programs that are specially designed for you as a family member. If you are an individual that lives with a diagnosed mental illness and you need support and education, we have programs that are specifically designed for you as well, so that you have that space of support and education and opportunities to educate our community as well. And then we have the community outreach, which is our advocacy and stigma reduction work that we do in our community to really raise awareness for the importance of mental health, to be able to recognize what it looks like when it's changing, what steps to take. What do we do if that's a crisis situation and we need to reach for help immediately or support someone immediately? And really those efforts are to, again, create hope for individuals on this journey, give them resource and information, guide them and point them in the right way, but also empower them with voices so that they can reduce stigma. And we do need to take action to do that. So sharing our stories is a way to do that. Extending listening ears to our friends and peers, sharing information that we may have handy, and really just giving someone safe space to sit and open up and start navigating on this journey. And in those 2 areas in that area of work that we do with the community outreach and education components, we spend a lot of time with our first responder community and helping our first responders be better prepared to respond in situations that involve mental health crises situations, so that they have the most tools in their toolkit possible, so that they're aware of resources in the community to connect to, but also components of having that information for their own families and their own loved ones that may experience challenges. And then also reminding them the importance of their wellness as well. Our first responders are definitely in a high risk career. We want to make sure they don't forget to take care of themselves so that they stay safe in the work that they do. And they have a quality of life that they're able to enjoy as we encourage everyone else. And then another favorite area of work that I get to spend quite a bit of time in is in our schools in the education system. And that includes not only our youth, that we are providing mental health education information, and again, raising awareness to reduce the stigma around experiencing challenges. We really need to normalize that people experience mental health challenges at any given time. Being prepared to take care of ourselves is important. But in addition to sharing that information with youth in our school settings, we also share that with their families, and we share it with school staff. So whether you are a teacher or an administrator, or you are someone working in the office that greets our kids as they're coming back and is answering the phones and talking with families, and just sharing what's going on. Maybe you're in the cafeteria and you're the lunch lady. Maybe you're someone out on the playground, on the yards, just somewhere out there on campus with our youth. We want you prepared as well to recognize signs and symptoms and know resources and next steps, how to connect our youth to the appropriate resources that they need to start learning healthy coping. What are the options available for them? What programs may be available for them to explore and navigate along with their families. And something we share with our youth and just general community members. 2020 brought us a lot of change and a lot of challenge. A lot of our usual activities, we didn't have access to them. And so we had to shift and change and find new ones, new healthy coping, new healthy habits. Some are very standard that we know we need to do. But when we are not feeling mentally healthy, we don't think clearly, and our emotions aren't very balanced, and we don't act like ourselves. So some of those things that were routine for us and we know we should be doing, we start to forget about them and we don't do them. And then we experience more of a decline in our mental health. And so when I talk about healthy habits, these are nothing that's really new to anybody. We all know we should have these habits. We should eat well. We should do our best to sleep well. And we should move our bodies in some way. We should be up and moving. But we should also add some things that boost our mental health. I always tell our youth, you go to school because you have to, because you're required to be in your classes. Those of us who work, most often we're going to work because we have obligations to maintain, bills and families to care for. So those are our obligations. But what are we doing that we get to pick that bring us joy, that are things that boost our mental health? And those are things like hobbies and extracurricular activities. And those have a wide range of things that interest individuals. For me, it may be going on trail walks, hikes. It may be doing something kind of silly and looking at fire truck TikTok videos, because I like that. I think the apparatus are fascinating. But whatever that is that's bringing us joy, we need to figure out what those are and have different ones, because sometimes we might not be able to use one and we want to balance and use another. But we also have an opportunity in this area to be very creative and tap in to our creative components. And that might be a form of art. It might be journaling. It might be drawing or sketching, painting. There's a lot of different ways. And music. Music is often something that can bring such joy to people, whether you are listening to music and identifying things that you want to hear, or possibly you are learning to create music. It's an opportunity to really add that component to your activities for your mental health. So that's a lot of what NAMI does, is we educate, we support, and we advocate for change in the community so that there are more resources available, we have access to them. we reduce stigma, and people have an opportunity to have a better quality of life when there's a challenge that they're experiencing. They learn how to navigate through that the best way possible, as early as possible, and in the shortest span of time possible. But we have to take action. We have to do work. So that's us. And I'm going to turn things over to someone joining me today in sharing. And I'm going to let Kelsey take it from here.
Thank you, Chris. And thank you for, can you all hear me okay? There we go. Perfect. Sometimes it takes a while to pick me up, but thank you for all the work NAMI is doing and for sharing all those resources. As Chris mentioned, I'm Kelsey, and I'm with Music Speaks. We're a music therapy company, so we provide music therapy services right now in the Fresno and surrounding areas. We serve multiple states, so you might see us grow also in California in years to come. But I thought I'd spend a little bit of time today, one, sharing about music therapy. What is it? We find a lot of people don't even know what it is, how it can help. But then also spend a little bit of time talking about how you might use music more purposefully, either for your mental health, with your babies, if you're stressed, and just give you some resources from the knowledge that we have on how you can use music more intentionally. And then from there, where then you might need a music therapist to help understand maybe some of the differences that way. So the best way that I like to describe music therapy is actually through a comparison. I think it helps make the most sense. But if you think about, and actually Chris hit on this, exercise. We all move our bodies or exercise in some way for health goals, whether that's to get stronger or to lose weight or to stay active. We might do yoga or Pilates or go on runs. I mean, lots of different options, but we all use exercise for our health. But there are occasions when a doctor or someone else on your healthcare team decides that you need a little bit more intervention that's more individualized to your goals. So you might see a physical therapist, and that physical therapist is looking at you and your needs, what your goals are, and really understands how the body works to tell you exactly what you need to do to meet that healthcare goal, so you can eventually go back to exercise and using movement and moving your body how you feel best. Music and music therapy parallel both of those. If you think of music like exercise and music therapy like physical therapy, that will help understand some of the difference of what a music therapist might be doing. So we use music. It's super powerful. We use it for a lot of different things. If that's helping us motivate when we're exercising, or maybe it's listening because we just need a good cry. And that song always makes us cry, or that song gets us pumped up. We might use it to help us sleep or relax. Again, lots of different ways to use music. But members of your healthcare team at some point, whether that's doctors, social workers, other organizations, may make a referral because they think you might benefit from music therapy. So then that music therapist, like a physical therapist, is breaking down music. So it's not so much about the instrument that you're playing for enjoyment, or you're listening to that song because it makes you feel a certain way, but really looking at how music impacts the brain, how rhythm, how complex the music is. What does playing that drum actually do in your brain? What neurochemicals does it release to help you meet goals that you might not be meeting otherwise? So in mental health, that might be decreasing anxiety or depression. Maybe it's orientation, confusion, expression. Infants, it could be calming, crying, pain, sensory development, and integration. So all these non-musical goal areas that we understand how to break down music to help you meet those goals, and then eventually maybe even make recommendations to how to use music in a different way that might continue to help you work on those areas. But you just need that person to individualize it for you. So as I mentioned, there might be more purposeful ways to use music. So I thought I'd share, I know I'm talking probably to a wide audience here. I thought I'd share a little bit about music with babies in particular. So moms, dads, family members, how you can use music with your infants, as well then as mental health. What are ways to be more purposeful in the music you're using for that? So with infants, One of the biggest things I just like to encourage families to do is, whether you have no music experience or not, use it. Your baby doesn't care what you sound like. They want to hear you, especially mom. Baby's always going to prefer your voice, and that can do a lot for calming as well. Baby's not going to care what you sound like, so sing these songs. I would argue, and it's been rare that I haven't noticed that when someone's singing, that doesn't grab a baby's attention more. It makes them, it's different. It sounds different. And the reason for that is because it's activating so many parts of the brain. So especially from like 0 to 5 months old, it's really important to use children's songs. And then around that 6-month age is a good time to maybe start incorporating music that you like to listen to. And a big reason for that is oftentimes those children's songs, not only do they promote development and are really useful for a lot of other areas, but the music itself is structured in a way that's predictable. It's repetitive. It can help baby learn concepts. It has a steady rhythm. It's not, if you think about an environment when a baby's new to the world, there's a lot going on that we're often not aware of. People talking, doors slamming, different sounds, different feelings, different settings. Their vision is coming, and lots of stuff to take in. So those children's songs in particular help create predictability and structure. You can do finger play with them. It's a great way to bond with your baby, especially maybe you have a child who has more complicated medical needs, or maybe you're in the hospital and you aren't able to care or bond or attach to your child the way that you'd like to. Music is a great alternative because it can just be auditory. You can start putting your baby's name into songs. You might be able to hold your baby's hands, write a song. I always encourage moms and dads, you can take familiar lullabies like You Are My Sunshine or Twinkle Twinkle and change the words to be more about your child. That's something that you can give and do for your child as well. The one other big piece of advice that I like to give parents is, especially when calming your baby, so maybe your baby's crying a lot, nothing's working, music can be a great way to calm your baby, but rather than just singing, the type of song you sing is going to matter and how often you sing it. So it's going to be really boring for you, but singing the same song over and over that's really predictable and simple is again going to have that predictability and familiarity for that infant, so they know what's coming next. There's an expectation there, and it's something that they know and can welcome. So even something as simple as hot cross buns. I don't know if you, hot cross buns, 1 a penny, 2 a penny, hot cross buns. That's 3 notes if you're not familiar with music, but that's really repetitive. Humming as well. Lyrics is more complexity. You process words in a different part of your brain than you would just humming. So you can play with that with your child as well. That's starting singing and then transitioning in that same song to humming can really help that calming effect as well. Within, I know I might have some NICU families or nurses or whoever you might be watching. One recommendation I like to give for NICU or for infants who have more medically complex needs is that we often use music a lot to help calm. And we think classical music or just really music that has a lot going on that's going to help maybe stimulate brains, or it's just there's no words so it can be calming. But classical music's actually really, really complex. There's a lot of instruments, lots of varying rhythms, lots of layers that can be a lot for a baby to take in. So again, you're looking for really simple songs. And in the NICU in particular, you're only looking for about 1.5 hours of music a day for especially babies who are medically fragile. And that's going to be a half hour on, a half hour off, a half hour on, a half hour off, because it's a lot of stimulation. So if you're playing music in the NICU environment, that's a really important consideration, and to have it at about 70 decibel levels. So that's about the volume of like talking. So pretty quiet, especially as those auditory systems are still developing. So this is where I like to show a little bit when I keep talking about complexity and the difference that it makes. I think this helps then highlight, you can use music really purposefully that way, but when might you need a music therapist? And that's when you might need that music controlled a little bit more to then help with that goal. So if we take the NICU, for example, and we have a child who is struggling to integrate. There's a lot going on, and they're crying all the time because they can't handle that sensory, their input. So they're learning to organize that tactile, the auditory. So we can control the music, which you can't necessarily with a recording. With a recording, you could turn the volume down or turn the volume up, but that's about all you can control. And sometimes you can't modify that volume the way you want it to. So an example here is I can control volume on my guitar, but this sounds very different. I mean, this is just one type of input. I hope you guys can hear this okay. And then that's different compared to a chord, compared to how I play that chord. You can really change up those chords. That adds a different type of sound and tension to that versus, or something really slow. I'm not even singing yet. I'm not humming. I don't have a drum that has tactile. So I think that helps illustrate a little bit a lot of what a music therapist is thinking about. Not only what type of music we're playing, but how we're playing it and watching for the response. So if we go back to that NICU example, when I play one note, is that too much for that infant? Watching for some of those overstimulation responses and helping be able to layer that input to eventually doing tactile and vestibular. So when there is a lot of stuff going on in the environment, they're better able to integrate because we've practiced and we've put that input in a way that helps them grow and develop. And so you can't do that with recorded music. And that's very similar then to, let's say, mental health needs as well. I mentioned we might use music to help us relax. So oftentimes people will turn to music that they like to kind of help them calm down. If you're really looking to relax, or maybe you have a lot of anxiety and you're really looking for solutions to help you manage your stress, decrease anxiety, using music that doesn't have words is going to be really important. I know some people like music with lyrics, but there's a lot of research that shows that the best type of relaxing music is not going to have words. And again, it's going to be really, really simple and repetitive. So you want to be searching for music that way. And I encourage you to continue music for relaxation. But when you might need a music therapist is, again, when we need to individualize that a little bit more. So maybe some of the techniques are not working. Your anxiety is becoming extremely hard to manage. You're processing it, but you just need something more. We're normally working with really high need when we kind of reached this point where we don't hit play, but I'm able to then give you exactly what you need musically. I can meet you where you're at if your anxiety is high, or maybe you're really depressed and you're working to be more engaged and alert in your environment, but it's just hard to get there. Just like being angry, if you were telling me how angry you were and I said, oh, it's okay, just calm down, you'd probably get more angry because you wouldn't want that. The same with music. If you're picking a song to help you feel better or to help you relax, and it's actually not matching you where you're at, it could have an opposite effect. And so a music therapist then is going to take some of that complexity that I talked about. I might be playing, if you're highly anxious, I might be playing louder, have more complexity in my chords. I'll probably have you playing with me, doing different rhythmic interventions, and then slowly modifying that music piece by piece to bring us down to where we want to be. It can go the opposite direction, starting really simple and then increasing that complexity. It's going to release different neurochemicals as well, which can be really great then for emotional processing. Maybe you have a hard time expressing emotions. Maybe there's trauma in your past and you're struggling to verbally process or even just be in touch with those emotions. Music therapy can be a great way to prime the brain for some of that processing. So we might partner in mental health settings to use different rhythmic interventions specifically because of the structure it provides to help you better be able to process or access those emotions or be in a group setting, providing some of that group cohesion. So lots of examples on how we might use it. I hope some of that got you thinking maybe about how you might use music differently than you have before. Or maybe that also made you think of a situation where, I wonder if a music therapist might help in this way. At Music Speaks, we do work with individual families, so we can partner directly with you, with your loved ones. More often than not, we're partnering with local organizations. So we work with organizations so they can provide music therapy for the individuals that they're working with on a referral basis in that way. And so we can really work with you on your healthcare goals. And in those type settings, we can then give that individualized care that you need, and then also make recommendations specific to you, almost like homework, like physical therapy. Do this exercise this week until I see you again, and that might help. Try this out. So you get more of that individualized care to really use music to the way that it's going to benefit you the most.
That's great, Kelsey. Kelsey, and how can an organization get in contact with Music Speaks Therapy so they can set up a referral, or maybe just work on training for their own providers?
Absolutely. I'd say the best way to reach out to us is just go to our website, Music Speaks Therapy. And if you go there, there's going to be lots of information, but there are different forms. So you'll see, like, if you're a family just interested in learning more, there's a form you can fill out there. If you're an organization who just wants to learn more or interested in partnering, there's a form for you to fill out there, and it will get you in touch with the right person on our team to be able to talk and communicate with you about that. So that would probably be the easiest way. And if you're an organization, it will likely be me that you're talking to that way too. So I'm an easy person to reach out to.
So we have the main.
Oh, you cut out there for me, Ramona.
Can you hear me?
Now I can. I didn't hear
okay,
you.
So like we have the main contact here, Kelsey.
Yes. If you're an organization.
That's great.
Yes, absolutely.
And Kelsey, it was good to know that, you know, when we're feeling sad maybe or angry, maybe using music with words is not the best idea. I did not know that. So that's amazing. So does Music Speaks Therapy have like a music streaming account or somewhere where people can subscribe to?
We do have a YouTube channel. During this past year, it was really difficult. We were wanting to give back a little bit. So we were live streaming, but you can find them on our YouTube page, and it's for different populations. So we'll have some for older adults, children, and anxiety, just kind of relaxation based. So you can watch those and get some suggestions and actually do some of the techniques. There's some like guided imagery paired with music that you could do. So definitely check out our YouTube video for some of that. And you can learn more about music therapy through those as well. Channel name,
Music Speaks?
Music Speaks, yes. And if it's helpful, I can email those to you, Ramona, if we want to include it in
yes, and I'll link them on our Facebook page. Okay. Thank you, Kelsey. That'd be great, giving them some moms specifically suggestions of playlists that they can have at hand for their babies and calm them down.
Absolutely.
And Kelsey, can you also talk a little bit more about how music, for moms, if they have like a colicky baby, maybe how, I know a lot of moms have difficulty when they have a crying baby in regard to bonding, how music will benefit the bonding in that nature?
Absolutely. I'd say two ways primarily is using music in ways, and maybe being more aware of how you're using music, and not just music, but also, are you holding your baby? Are you rocking your baby? Because those are all different types of stimulation. So with bonding in particular, when your baby maybe isn't crying, music can be a great way to help with that bonding. Like I said, is it writing a song to help? And that's what you're using every time. A really simple one that's easy to use it's Elmo's song. La 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 la, Elmo's song. But instead of Elmo, you could put your child's name in there as well. So that's a really easy, simple songwriting. And just the act of creating something or doing something for your child inherently has some of that bonding in there. Thinking about, trying to think of some other songs here, doing like singing the ABCs, but singing new words, singing to your baby about what you're doing to care for your child, like singing, and it could be making it up on the spot or using the simple tune, but even just knowing that, like covering your child with a blanket or feeding your child, and singing those things that you're doing can also be helpful reminders. to help with bonding there. And then as you're actually caring maybe for a colicky baby, as I mentioned, a little bit about calming some of that simple repetitive singing. You might notice a difference there. I'd also pay attention to what you're doing while you're doing that. Like, are you just humming or are you walking around and humming? That's, that's two different types of sensory input. And so just having that knowledge, it's almost a little bit experimental, but maybe see what your baby needs. Do they need more or less of something? So that might help you feel better and that you're doing something really intentional to help the need of your child, because it can be really hard when a baby's crying all the time. So sometimes just knowing like, hey, I have control over my voice. I have control over how I'm holding my child or how I'm rocking my child, and seeing what those changes are. And that's something we can talk and share more about too. But even using, if you have instruments at home, that's a great way to just to play, tracking, handing, working on grabbing for some of those developmental goals as well. It's another way to just continue giving to your child when it may seem like there's not a lot working. They're always going to want to hear your voice. So I'll over and over that's a lot for your child as well.
Yeah, we can turn anything pretty much into an instrument.
Yes, absolutely. You really can. Bang, tapping, and even some of the finger play and doing hand over hand with your child, or bouncing. So that inherent bounce as you're like singing a song, that's rhythmic. And so that's going to, again, kind of create some of that predictability. So if you're singing a song and have baby on your lap and are kind of bouncing to the beats, that can also be really helpful as well.
I hear benefits back to mom too. Being, while mom is soothing the child, in turn, that engagement with the music component, the creativity, the singing of it, the making up the words and whatnot, that gives mom's mental health a boost as well. Love it.
Right, Chris? I think I remember reading somewhere it said your hand is an attachment of your heart. So like writing, and it's kind of like a form of expression. So.
Yeah. And I remember being encouraged to talk to my children a lot while they were babies. And of course they're older now, but they're excellent communicators, but I'm grateful. I believe a lot of that supported that development for them in those early months and years. And I was one of those moms that would make words up to those tunes. Mary Had a Little Lamb. We would insert their names in silly songs, and we've got a couple that are just things we came up with. And we still sing them today, and my children are teens and young adults. So it has had a positive impact for our family. It's really nice to hear the importance of it for the development of our children. I think talking to my children, I was encouraged. I don't remember ever hearing the encouragement of the singing components and how that would benefit them. But definitely I can see positive impacts. It's nice to hear it explained, Kelsey. So thank you.
Of course. And a fun little experiment, if you have little ones at home or even toddlers, to talk almost, the baby talk, that's encouraged as well, to see the difference from baby talking and talking to your child, and then start singing and notice the change sometimes that baby has. There's a lot. I have a little niece right now, and I like to play with this sometimes with her, because every time I start singing, it's just like, oh, that's different. And so you can use that to your advantage as well in trying to, look and work on different sounds. There's great songs to do that, and oohs and ahs and clapping and using that for motivation. So yes, benefits for both baby and mom. And it's sometimes fun to see that power of music where we don't have to do anything besides just sing. And the music will do that work on its own.
Exactly. And let's add dad into the equation. Yes. And now we have our family band, family singing group.
Yes, let's have dad participate.
Yeah. And, I think having the explanations like this, Kelsey, really help other family members that may be caregivers for the children, so that mom feels even more supported, and that environment just really a healthy place for the child, but also a healthy place for mom.
Yes, absolutely.
And Kelsey, and Chris too, do we know specifically, like if there's a crisis situation, if music can, or how it can be used to calm down a person, or do you believe in a crisis situation, music is, not the best way to start calming them down?
It would depend really on the situation.
Yeah.
We'll be an example, like I know Chris talked about the schools a lot. So for self-harm behaviors, agitation, having a difficult, sometimes that might come from just the ability, it's oftentimes sensory again, that music therapy can be really beneficial in that setting. Kind of the ISO principle I talked about before, matching and then decreasing. So those type of situations, can be used often. We're not licensed counselors. So we have, therapists have basic training and kind of some crisis management, verbal processing, but that's not our area of expertise. So often we'll partner when working in like mental health crisis scenarios, partner for more of the preventative or to help, again, like prime the brain for some of those things. So yes and no. And I wouldn't make super great like music recommendations for those crisis scenarios. Those are often the people that we're working with and long-term working with, and that's why they need music therapy. I don't know, Chris, if you have additional stuff to add to that, but
I don't. I want to support that. At NAMI, we're not mental health clinicians either. We're people walking this journey too. I know that when someone is experiencing a crisis situation, we may ask them, what are things that have helped soothe you or help you to feel calmer? Again, be very, very aware of that word calm and someone perceiving it as you telling them to calm down.
Yeah.
Not a helpful statement. I don't know anyone that's actually calmed when that's been told to them. But really asking things, and a question could be asked, do you find a particular music helpful to listen to right now? Can I pull that up, in my playlist for you? Can we find that? That's a key question to ask someone who may be struggling in a crisis situation. And yes, some music's not appropriate. It will continue to elevate someone in their mood and their symptoms. And so just being aware of our surroundings as well.
That's a great time to also make a referral to a music therapist too. If some of those have been identified, and that's where that they need a little bit more of that individualization, whether that's for a long-term or short-term, acute or, long-term that way. So that's a kind of a good example of a time when making a music therapy referral, because we'll do an assessment, just like physical therapy, we'll assess and develop treatment plans and make sure that we're providing the best care for those individuals.
I love that knowledge, Kelsey. That's so helpful to pass on to families and individuals in the community that do use music as a form of coping with symptoms of whatever mental health challenge they may be experiencing, and encouraging them to explore it more. To really have a plan suited for them, to know how to best use music to support them. Fantastic.
Absolutely. It's exciting about, and I'm excited to see, we can do so much more research too. So I'm excited to learn more and share, because I think there's so much we don't know too about music, because we use it all the time, everywhere. And so it's exciting to explore, and I just encourage people to use it more and explore how they're using it in different ways, because it's powerful.
Well, I appreciate you being here today, Kelsey, with me as well, sharing about NAMI, simply because these are the kinds of things we want to connect our community members to. So they're aware of, many people, when they think about treatment for mental health challenges, the assumption automatically goes to medication, that medication is the option to use. And for some people, yes, that may be a component. But I encourage people to explore all of the options that are available. And that includes exploring something like music therapy. And maybe it is the primary option for their challenges. Maybe it's a component, and maybe it can help them overcome some of those barriers when medication is really necessary and imperative for them to maintain recovery. Maybe they can ease some of that anxiousness and whatever concerns arise from needing that as part of their journey, maybe they can add music therapy in that so that they still, again, get a boost in their mental health and can still enjoy better life.
Mm-hmm. Mm-hmm. That's great. And Chris, I have a question for you. Do you have any, or if a provider wants to train on mental health first aid, do they go directly to the website?
They can. The fastest way is to go to Mental Health First Aid's website and look up their local area for a training in their area. It can be done via Zoom. It can be done in person as we slowly reopen things. As long as we have adequate space for physical distancing in a classroom setting, the class could be taught in person. Again, I teach it. I absolutely love teaching it. So if it's something that you'd like to have NAMI support a training request, then I encourage you to reach out and contact me directly so that we can look at our calendars and the size of your staff or your group in the community and explore best options virtually or in person. And, Mental Health First Aid, for those who aren't very familiar with it, or maybe a little bit, Mental Health First Aid is a program that I refer to, and many of us do. It's similar to CPR training, but it's for mental health. And it's really being prepared with an action plan when you recognize that someone is struggling with mental health challenges and being able to offer and extend first aid support for that. So we're not participating in the training to become clinicians and professionals and experts on this. We're actually helping to get them to the appropriate resources that they need, whether that's appropriate professional help. Maybe they need to be listened to. We are assessing. We are always assessing for the level of risk that's involved in someone who's expressing mental health challenges. And maybe we add and encourage those self-help and other support strategies. The reason I love this training so much is we learn a lot in it, but then we actually put it to use because we do some scenario work. And so it's very helpful to learn a lot of information and learn about the steps in a plan. But what happens when you recognize something that you've learned and you've never practiced it? So that's the beautiful thing about mental health first aid training. And it's a certification that stays with that person, just like a CPR certification would. It's a 3-year certification recognized nationally. You just become a better community member by having that training, but you'll also become a very, very valuable member in your family, member at work, member in your faith settings, member in your cultural groups that may be doing things, because you'll be able to recognize the warning signs and you'll have confidence to be able to extend support and guide someone in the right direction that they need in the best way possible.
Yes, Chris, it's very important to recognize and know how to act on it. So I love training.
Yes, it's one of the very early trainings that I took when I joined NAMI's organization. I'm not a clinician. I don't have those credentials. I've not spent thousands of hours earning those wonderful letters after my name. But I do have lived experience that's a valuable component to add to what our clinical providers do for us. But mental health first aid was designed for the common community member, and it gave me skills. It gave me an action plan, and it gave me confidence to be able to support members in the community. And I use it so often when I recognize challenges, when I want to just open a conversation with someone and give them that safe space. That action plan and information I learned in that training, I've been using for at least 6 years now. I believe I took that training after I was with NAMI for about a year. Valuable, valuable stuff.
Yeah. Thank you for joining us, ladies, incorporating and collaborating with mental health and music and how we can use both of them and merge to help our family or our providers can help their patients and clients. So thank you so much for joining us and helping us with this Maternal Mental Health Awareness Month.
You're welcome. Thank you for the invitation to share. And Kelsey, it was a treat to be partnered up with you today.
Absolutely. Thank you all so much. And Chris, right back at you too. It's been I've learned so much too. It's exciting.
Thank you.